On July 2, 1944, in a cave hospital close to Cherbourg, France, Dr. Schwester stepped out into the sunlight with her white medical coat hanging loosely on her shoulders, raising her hands in surrender and shielding her eyes from the blinding light after days of darkness. She had told her fellow nurses just hours earlier that the Americans' claims about having abundant medical supplies were nothing more than propaganda meant to undermine their morale. This skepticism would soon be shattered along with many other assumptions. Schwester into the daylight were 8 additional German army nurses, among the first to be captured by American forces during the invasion of France. They had spent their final days in the besieged cave hospital, treating wounded soldiers under candlelight, using up their last vials of morphine and repeatedly boiling bandages for reuse. None of them could have imagined that within hours they would witness medical practices that contradicted everything they had been taught about American inferiority and German superiority. Johnson, the commanding officer at the 45th Evacuation Hospital in Lamb, observed them with interest rather than hostility, viewing them as both enemies and fellow healers. In accordance with the Geneva Convention protocols, these nurses were to be returned to German lines within days. However, before their release, they would experience firsthand the medical advancements in America. During 1944, medications that had only been whispered about and surgical techniques far beyond their training. The psychological impact of these experiences would linger long after their brief captivity ended. The unraveling of German beliefs began over a year earlier on May 13, 1943, amidst the sweltering heat of Tunisia, when General Hans-Jürgen Pfennig surrendered not only his combat troops but also thousands of medical personnel, including Dr. Schwestern from Rammel's Africa Corps, who had served through 2 years of desert warfare. RTRK Schwestern Ilse Schultz, who had been awarded the Iron Cross Second Class in April 1943, was among those captured. Schwestern Greta Falk, also honored with the Iron Cross that same month, meticulously documented observations later found in German military archives. The Americans discarded more medical supplies daily than we received over an entire month, and they possessed medications of which we had only heard rumors. The scale of surrender was overwhelming, involving between 250,000 and 255,000 Axis troops, including nurses and doctors from elite divisions such as the 21st Panzer Division, the 15th Panzer Division, and the 90th Light Division. While most captured medical personnel were male-female nurses faced a particularly profound ideological shift. Medical officers categorized the captured within hours based on their need for treating German wounded or evacuation. Each captured nurse underwent a thorough medical examination using equipment that was scarce in the Africa Corps. By June 1943, groups of captured German medical personnel began boarding Liberty ships bound for the United States. Their medical facilities were state-of-the-art, featuring operating theaters with reliable electric lighting, functional X-ray machines, and refrigerated medicine storage. Most striking was the abundance of blood plasma supplies, properly typed and stored units that could be administered safely, unlike the risky direct transfusions attempted under field conditions by German forces. Daily revelations aboard these ships underscored the vast disparity in medical resources between the Americans and Germans. For instance, sulfur powder rationed grain by German forces was used liberally by American troops. All single-use bandages were discarded by the Americans, a practice that would have been unheard of within the Wehrmacht. Surviving German medical workers, accustomed to living on meager rations, observed the American medics throwing away untouched food portions. The waste they witnessed contradicted years of propaganda, suggesting a weakened nation battered by economic depression. Medical personnel from Germany arrived at ports ranging from Norfolk to New York aboard ships, and were greeted with scenes that refuted everything they had been taught about America. In Norfolk Naval Base, captured individuals underwent thorough medical examinations, including dental work, treatment for infections, and provision of corrective lenses, often unavailable to German civilians. During their train journeys inland, they saw numerous cities illuminated by well-equipped hospitals. From Richmond's Medical College of Virginia complex to Philadelphia's imposing Pennsylvania hospital structures, every major urban center boasted superior healthcare facilities compared to those in Germany. At a stop in Washington, D.C., American Red Cross volunteers boarded the trains with care packages for German prisoners of war, including toiletries, cigarettes, chocolate, and writing materials, a level of kindness that conflicted with their ideological training on racial struggle. Camp Opelika in Alabama welcomed its first Afrika Korps medical personnel in June 1943, after opening in September 1942. The camp hospital became a unique setting, where German medical staff trained in Nazi racial medicine worked alongside American clinicians practicing conventional clinical care, adhering to the requirements of the Geneva Convention. American medical officers supervised while German personnel provided direct patient care, creating an unprecedented and complex working environment. German medical staff were astonished by the advanced facilities within the American military healthcare infrastructure. Operating rooms featured cutting-edge equipment that they had only encountered in textbooks, including electric anesthesia machines, adjustable surgical lighting, and rapid sterilization autoclaves. The pharmacy boasted hundreds of medications stored under climate-controlled conditions with expiration dates far into the future. On July 21, 1944, Glennon General Hospital in Okmulgee, Oklahoma, transformed into German prisoner of war General Hospital No. 1, accommodating 1,690 beds and operated by both American and German medical teams. The German nurses from the NSV, National Socialist Women's League, who had been instructed that American medicine was inferior and corrupt, encountered a system grounded in rigorous scientific methodology. Perhaps most challenging to their preconceived notions were the African-American nurses assigned to treat enemy prisoners due to U.S. military segregation policies. These professionals provided highly skilled care, directly contradicting racial stereotypes ingrained by Nazi ideology. No demonstration of American medical superiority was more striking than penicillin. In 1943, the United States produced 21 billion units. By 1945, production had surged to 6.8 trillion units. Witnessing this miracle drug's routine use in treating infections that would have been fatal in German field hospitals left a profound impression on German medical personnel. At Camp Forest in Tennessee, which housed German POBOs and featured extensive medical facilities, German nurses observed remarkable conditions. Where German surgeons might have resorted to amputations, American doctors managed to save limbs through innovative treatments. Freely sharing knowledge with enemy combatants was an alien concept for German medical personnel, who were accustomed to strict hierarchical and secretive practices. Additionally, the American blood plasma system represented a significant leap beyond what was available in Germany at that time. Correct typing procedures, cross-matching methods, and proper storage practices prevented the potentially lethal reactions associated with direct transfusions that were still prevalent among German forces. At establishments such as the 21st General Hospital in Ravenel, France, where captured German personnel worked from December 1944 onwards, the blood supply system operated with remarkable efficiency. Plasma was stored for extended periods and transported over vast distances before being administered without knowledge of specific blood types, a level of medical advancement that surpassed what German medicine had achieved. German nurses trained in the NS Western Shaft were indoctrinated to believe that medical practices served the purpose of racial improvement. Their curriculum included teachings on eugenics, heredity, and racial studies, emphasizing the idea that weak individuals should be eliminated for the betterment of the race. In contrast, at facilities like the 12th Field Hospital's P operation with its capacity of 30,000 beds, they observed a starkly different approach. American medical staff treated German prisoners in exactly the same manner as Allied soldiers, providing them with equal access to scarce medications, surgical treatments, and nursing care. This fundamental distinction between viewing medicine as universal healing rather than a tool for racial advancement began to erode their ideological beliefs. Christmas 1943 had an especially profound psychological impact on many German prisoners of war. American organizations sent out 500,000 packages to German POs, each containing wartime luxuries such as coffee, chocolate, cigarettes, and soap. At Camp Alva in Oklahoma, which housed personnel from the Africa Corps, local churches sang traditional German carols, while Boy Scouts delivered handmade cards. Families with sons fighting overseas sent homemade treats, ensuring that the Christmas feast, featuring turkey, ham, vegetables, and desserts, exceeded anything these prisoners had experienced in years. German nurses meticulously recorded their confusion at witnessing enemies extending Christian charity when their own propaganda preached hatred. By 1944, initiatives like those from the Special Projects Division began implementing comprehensive educational programs for German POZs. Nurses attended lectures at institutions such as the University of Nebraska Medical School, located at Fort Robinson, on topics that challenged and transformed their previous beliefs. Medical ethics and patient rights, along with the application of the scientific method in clinical settings, were central themes. The pedagogical approach promoted questioning, debate, and disagreement, which contradicted the traditionally hierarchical structure of medical training. Access to American medical literature was another source of surprise. It revealed that numerous advancements made by German scientists had been developed by Jewish researchers who were later expelled due to the Nazi regime's policies. This discrepancy created significant cognitive dissonance. As American medical personnel deployed to Europe, they observed an increasing number of German nurses staffing military hospitals. For instance, at the 45th General Hospital in Bari, Italy, on July 31, 1945, these nurses worked under direct American supervision. Pfeffer's hospital treated patients from various nationalities equally, including Allied soldiers and Italian civilians, alongside German prisoners of war, PSWs. Electrocardiographs, which most German nurses had never seen before, were standard equipment. Facilities such as the 3rd Convalescent Hospital, operating from May to September 1945, provided an opportunity for German nurses to learn how to use advanced medical devices they could only imagine. Techniques like autoclaves that sterilized instead of hours, electric suction replacing manual pumps, and even simple innovations like adjustable beds were all new advancements. The spring of 1945 brought the most profound realization of this disparity. Footage from concentration camps was shown to former medical personnel of the Nazi regime, putting them through an intense moral dilemma. As evidence accumulated, initial denials began to fade. American medical officers entering the camps provided testimony and photographs that confirmed the atrocities. Letters sent from Germany also corroborated these grim realities. They had been part of a system where medicine was twisted into murder. American officials approached this situation professionally by emphasizing that it wasn't medicine itself that was at fault, but rather its misuse under an ideological framework. Denazification efforts for medical personnel were carefully planned and implemented. Compulsory courses focused on medical ethics and democratic principles, utilizing case studies to illustrate how racial medicine harmed patients while scientific approaches benefited them. At Camp Opelika, Lieutenant Colonel Dorothy Whitman organized sessions where German nurses observed American nursing practices. She highlighted the importance of documentation and patient advocacy. The message was clear: technical skills alone were not enough without ethical practice. Hospitals routinely discarded medications that had barely expired, which Germany could not produce due to scarcity. Instruments were replaced at the first sign of wear rather than being repeatedly repaired and used until they broke. This level of resource availability contradicted Nazi propaganda by demonstrating how America produced vast quantities of medical supplies. Without conquering new territories, Germany found itself fighting for resources that America created through its industrial might, further emphasizing this disparity. American nursing practices fundamentally challenged the professional identity of German nurses. The rigid hierarchy and demand for unquestioning obedience in Nazi Germany stood in stark contrast to the autonomy enjoyed by American nurses. They were encouraged to question doctors' orders, suggest alternatives, and make independent decisions within their scope of practice. This professional model, unfamiliar to German nursing, represented a transformative shift in role and responsibility. Captain Helen Morrison at Glennon stated, "It is your duty to ensure patient care outcomes. If there are issues, voice them without regard to authority levels." This statement altered the nurses' perception of their role significantly. The presence of African American medical staff caused considerable cognitive dissonance among German personnel. Observing black professionals displaying superior knowledge and skills was particularly impactful. Lieutenant Elena Powell at Camp Florence in Arizona supervised German nursing staff with a level of professionalism that challenged prevailing racial stereotypes. Why? The irony was evident to all involved. Despite American segregation policies assigning black nurses to enemy prisoners, this arrangement still yielded better medical outcomes than Nazi racial doctrines allowed for. After Italy's surrender in September 1943, Italian medical personnel who cooperated were treated more favorably. German nurses witnessed former allies receiving preferential treatment while they remained under stricter control. This pragmatic approach prioritized current cooperation over past allegiances, sharply contrasting with the rigid ideology of Nazi Germany. Italian nurses enjoyed greater freedom and access to resources compared to their German counterparts who adhered strictly to Nazi beliefs. Even as prisoners, German medical personnel received extensive training in new techniques, medications, and equipment operation from American officers. This knowledge sharing included advanced burn treatments from Pacific experience and surgical innovations from European combat scenarios. Recognizing the destruction of their homeland, German nurses documented all they learned for future application. By May 1945, as the war concluded, American authorities prepared German medical personnel for repatriation through comprehensive training programs. The curriculum included public health, epidemic control, emergency medicine, and techniques for restoring Germany's medical infrastructure. Colonel Richard Stevens addressed them by saying, "You are heading back to a nation with significant medical needs, and this training is an investment in the democratic future of Germany." The instruction covered setting up clinics with limited resources, educating auxiliary staff, and enforcing public health measures. German nurses were awarded certificates recognizing their American education, which was highly regarded in occupied territories. Nurses who returned from 1945 to 1945 to 1946 discovered that 60% of hospitals had been destroyed. They introduced not only advanced American medical techniques, but also a fundamentally different approach to healthcare. Ex-PWS, prisoners of war, established nursing schools focused on patient advocacy rather than ideology. American medical practices were implemented in the reconstructed facilities, including blood banking systems and systematic antibiotic use according to American guidelines. By November 1945, with few remaining American medical staff in Germany, these trained Germans became crucial for maintaining public health. The impact of this training lasted beyond the immediate post-war period. By 1950, many German nursing schools were led by former PWS, who integrated concepts learned during their time in American camps, such as nursing diagnosis and ongoing education. Pharmaceutical companies also adopted quality standards observed during captivity. Hospitals restructured based on models seen firsthand from American influences. This shift toward scientific medicine rather than ideological practices became permanent. The statistics illustrate the extent of this transformation. The total number of German POZs serving in the United States was 371,683. Over 200 medical facilities employed German staff. There were more than 100,000 documented hours of medical education provided. Hundreds of thousands of medical procedures were carried out by these individuals. At least 15 nursing schools were established in Germany by returning POs. Dozens of hospitals within the U.S. zone underwent restructuring based on American models. Each trained nurse influenced dozens of their colleagues, and each reformed hospital treated thousands of patients. The impact spread far and wide, growing exponentially. In 1995, surviving German nurses who had been held as prisoners by Americans issued a statement. They acknowledged serving the Nazi regime but emphasized witnessing the corruption of medicine under ideological control, which transformed it into a tool for death. In contrast, American healthcare demonstrated the power of science and compassion in saving lives. The abundance of medications, technology, and resources was beyond their wildest imagination. But more importantly, they observed that treating enemies with dignity and equal care is an essential principle of medicine. Upon returning home, these individuals carried not only medical knowledge, but also a deeper understanding that healing surpasses national boundaries and ideological divides. They urged future healthcare professionals never to allow medicine to serve ideology over the act of healing itself. American doctors and nurses taught them through their actions that treating enemies as humans deserving compassion is at the heart of effective medical practice. Initially arriving as prisoners, they departed with a profound transformation. Our departure marked the observation of medicine's genuine essence. The metamorphosis of German nurses under American custody during World War II exemplifies one of history's most effective ideological shifts. They were not only exposed to advanced technology, but also witnessed the core principle of healing that transcends discrimination. Their transition from adherents of Nazi medical practices to advocates for scientific medicine underscores the impact of personal experience over propaganda. Consistent encounters with American healthcare practices achieved what coercion could not, resulting in a profound ideological transformation. The 9 nurses who emerged from Cherbourg's clandestine hospital on July 2, 1944, symbolized thousands who underwent this enlightenment. They entered captivity convinced of German medical supremacy, but left recognizing that true excellence stems from scientific rigor, abundant resources, and universal empathy. This represented America's most significant triumph in the realm of medicine, illustrating through everyday practice that a humanitarian approach outshines an ideologically driven one. The captured nurses did not merely suffer imprisonment, they were transformed by their encounters with the genuine purpose of medicine. Their conversion laid the groundwork for post-war German medical practices to be rebuilt on principles of humanism rather than racial doctrine. This transformation demonstrated that even those thoroughly indoctrinated can change when faced with undeniable proof of a superior methodology. The nurses who fell into American hands discovered that their adversaries possessed not only greater resources, but also a more enlightened medical philosophy. They had been taught that medicine served the ideology of race, yet they learned it should serve humanity. This lesson acquired during captivity would fundamentally alter German medicine for decades to come. Their story serves as a testament. Medicine rooted in science and compassion will always prevail over medicine corrupted by prejudice and ideology. Those who were once captives became observers. Former adversaries turned into partners. This metamorphosis led medicine back to its true calling, healing without boundaries, practicing science free from bias, and showing empathy towards everyone in pain.